We are back on MorningLine. Thanks for joining us this morning. We're talking, as you see on the screen there, heart health. You have questions about that. The number's there. With us this morning is Dr. Joshua Beckman. He's over at Vanderbilt, and it's good to have you on. He sees patients, he researches, and he's an instructor. Right?
Yeah, I do all three things because I think that's my job.
Yeah. Right. Well, listen, I appreciate you coming on. Part of his job today is to answer some of these questions. All right, real quick on this, and we've got some calls. Lines are open if you want to jump in. The issue of statin drugs. Just myself, I don't mind sharing my personal medical history. You know, whenever I go to the doctor's office, they have me sign that HIPAA thing or whatever. And I'm like, you want to know my medical history? I don't give a crap. I sign it. If anyone wants to ask off the street what my medical history is, have at it. I know some people don't feel the same way. I guess I have nothing to hide, but I don't care if you learn that I had a nasty rash a few weeks ago or that I have high cholesterol. Doesn't bother me. So I will share now. My cholesterol has been over the years, it's a genetic component, because I'm fairly lean. I work out. I try to eat well. I love lamb chops. But I have decided, even though my doctor has told me, Nick, you should be on a statin. And I was on a statin for a while. Some of them great, Crestor, Lipitor. One of them I thought messed with my memory. Maybe that's okay, but I came off it. My wife and I talked about it. I have no other risk factors of all of them that we talked about. None. My one risk factor is high cholesterol. I have a pretty good HDL-LDL ratio, but I just went and had another blood test last week, and they left a message on my machine before I came up here, and I'm sure the doctor's going to say I'm up probably near 300 total cholesterol, and he's going to say you need to go on a statin. I don't want to, but I also am not going to cut out complete total fats. Am I being foolish saying I don't want to take a statin drug for the rest of my darn life?
Yes, I think you're being foolish.
Okay, because I'm just like, I don't want to.
I have this conversation with patients all the time. Everyone says to me, I don't want to take medicine. And my answer to that is, nobody wants to take medicine. Mm-hmm. But you were smart enough to come to the doctor's office and ask. Sure. Because that means you're concerned at least a little bit to figure this out. There are a couple of ways that we can figure out the answer to you specifically. The American Heart Association and American College of Cardiology have a risk calculator that's online, and you can judge your 10-year risk and also your lifetime risk of having a heart attack or stroke.
Okay.
And so you could plug in your own numbers, and it's a really simple stuff that you know already. It's your age, your sex, diabetes, high blood pressure, cholesterol numbers, and you can see what your risk is. The American Heart Association would suggest that if your risk is more than 7.5% over 10 years, you should be on a statin. And I would certainly agree. Now, I would say if your total cholesterol is 300, remember when I was saying that when we were talking about the balancing of cholesterol and smoking,
right,
and what a really high number for cholesterol is? 300 is a really high number for cholesterol.
Even if the ratio HDL-LDL is really good?
Even, because there's no way. Yes, I would say that my bet is that your LDL is probably pretty high. And what we really worry about it when it's above 180, 190, because we wonder if you have a familial tendency to have high cholesterol.
Yeah, and I guess my thing, and by the way, I'm not against taking medicines. Heck, when I've had infections and need antibiotics, I'll take them. I know I'm not anti-pill. I'd prefer not to take them if I can avoid it, but I'll take them when it can help me. My take is, and I'm not stupid in the sense that it keeps going up and I'm going to just ignore it. That was my thing. I was around 235 or something like that, and I said I'm done with these statins for a while, and I'm going to try to control it through diet, which I have not been good at, and everything else. If I do inch up to 300, I will consider going on the statin again. Now, what about the issue of some people complain about muscle pain? I never had that. Liver enzyme counts. I do think something, not badly, but it just seemed like it messed with my memory. Have there been reports of symptoms like that?
So there are certainly lots of reports all over the internet that people are complaining about things like that.
Okay.
When you look at it, though, in the really large clinical trials, yeah, there are people who have muscle aches, and there are, I would say that different statins affect different people differently.
Sure.
So if one gives you muscle aches, you should ask your doctor to switch and go to a different one. The memory issue, I think, is an interesting one. It turns out that over the long term, these medications help to preserve your memory because they help the blood vessels in your brain stay healthy.
Meaning like it could be something to actually help prophylactic for Alzheimer's?
I wouldn't say that. Okay. I don't think that's well enough established to make any statement like that.
Well, is there anyone out there right now that does not have high cholesterol and is taking a statin drug for that reason?
For Alzheimer's, not that I think.
No, not for Alzheimer's. But would there be a reason to take a statin if you don't have high cholesterol?
Yes. So there's a couple of reasons. One, I just told you about a risk calculator. Your risk can be high independent of your cholesterol. Two, if you have any heart disease or you've had a stroke or you have other manifestations of atherosclerosis, blockages in your blood vessels, you should be on a statin. And in fact, you should be on a high-dose statin.
Okay. But I was just wondering, if someone who's otherwise very healthy, would there be a reason for you to take a statin just as a precautionary thing?
No, no, I don't think it should be in the water.
Okay. And as far as the the different types, you're right. If I have an issue with one statin, there are so many out there. I'll tell you, the one that I thought worked the best, even though I wasn't sure if I had some was Crestor. Holy cow. Lipitor was great, and it's got a long track record. And then maybe I'll go back on that. But Crestor, you took that and boy, did it go down fast.
Yeah, you know, I would say it is an incredibly potent one, and you need a lowered dose. But I'll tell you that as long as you get to the cholesterol goal, it doesn't matter which one you're on. Okay,
and what do you think about red rice yeast or niacin?
So red rice yeast has some statin-like components in it, and people think it's better because it's natural, although it's really hard to find chemicals that don't come from nature.
Yeah.
But what I would say is, unfortunately, the products are not reliable enough in how much of the medication they give you, and so you want to know what you're taking. And so I'm a strong advocate for taking medications that are regulated by the FDA, so I know what I'm getting, and I also know what I'm not getting.
Gotcha. All right, let's take I'm sorry, go ahead.
I'll just say niacin. We're using it less and less. We're using it less and less because it didn't seem to work much when it was added onto a statin.
Okay, interesting. All right, let's take we do have some phone calls. Lines open, and we'll start off with Mark. Good morning, Mark.
Hey, how you doing? Good morning.
Good morning to you. What's on your mind?
I just had one question. I just like to ask the doctor, is my cholesterol like 152? Is that good or bad?
Ooh, he's looking good.
So I actually think 152 is pretty good. I'd like to know what the balance is of the good cholesterol and the bad cholesterol, but 152 is a pretty good number to start.
Would you explain, by the way, LDL, HDL for folks?
Sure, there are several. So when we get a total cholesterol number, it's actually made up of a few components of cholesterol. So it's made up of the bad cholesterol, low density lipoprotein, LDL, high density lipoprotein, HDL is the good cholesterol, and then there's also triglycerides.
Okay, and so he didn't say, I get, when I do my blood scan, I get the cholesterol breakdown, and then a separate setting is triglycerides usually for me.
Right, so it's another kind of fat that moves through the blood as an energy source.
Okay.
And so I would say it's the third most important of the three components.
Okay, and the idea of ratio is if he's 150 and he has a high HDL and a low LDL, that really puts him in a good position, doesn't it?
A really good position.
Okay, 150 though sounds like a pretty good situation if his ratio
I think so.
Is good.
I mean, it would be an unusual case that his bad cholesterol made up that entire span of cholesterol.
Okay, sounds like he's good. Let's go next to Joe. Good morning, Joe.
Good morning, Nick and the doctor. I'll start off with heart disease runs in my family. So I'm under the impression that heart disease sometimes is hereditary. And you know, it's in their DNA. And I've had my mother, father, and a lot of the families had it. But I take statins and take Tricol, Crestor, and Metformin, and Glomerulpride. So they do have some side effects that make you feel bad, and you do have some cramps sometimes. And you know, I have leg cramps, you know, sometimes off and on, but that's just part of it. My HDL is always low, and we've tried everything in the world to get it up, and it just, you know, it stays around 40. It won't get up to the 50 mark, and just, you know, my cardiologist finally told me, he said, well, it's, you know, sometimes that's just the way it is, and there's nothing you can really do about it. So that's kind of the way it's going. The question I really had was on the A1C. My A1C sometimes runs a little bit high, up around 7. I know about 5 is considered good. What is the upper level that really starts getting dangerous for you. I mean, I've had 2 open heart surgeries. I had one when I was in my 50s, and then I had one in 2013. So, you know, this is something that people need to pay attention to, because I'm here to tell you I've dodged a bullet several times, it seems like. But would you just address the A1C readings for me?
Absolutely. So hemoglobin A1C is actually,
okay, what is it?
Yeah. Right, it's a marker of how high your sugar is over time. Okay. And it's a really good barometer for where you've been for the last 3 months. The American Heart Association and the American Diabetes Association all would suggest that you want to get your hemoglobin A1C, if you have diabetes, below a level of 7%. And in fact, if he's telling me that he's spending most of the time in the 6s, he's meeting that requirement.
Okay. All right. So that's something that is tested and monitored in diabetic patients. Is that it?
In patients with diabetes, that's right.
So you have to pay attention to that. So somehow that's being controlled for him then. The 6 is okay.
Yeah.
Gets dangerous above 7.
That's right. That's when you begin to have other problems like kidney problems and vision problems.
We talked about ways that maybe you can lower your cholesterol. Are there some things that link to, and he's tried, raising your HDL? I've heard exercise is one. My HDL, and I had no idea, it's like 80, okay, which was okay. I mean, that wasn't bad.
That's quite good.
Yeah, and so, again, my LDL is pretty lousy too, but is that a way to do it? Other ways to increase your HDL?
I think his experience is very similar to everybody else when trying to raise HDL. Yeah. You're right, exercise can raise it. Red wine can raise it, but it's really hard to raise it that many points. I think, and his experience is exactly like every other patient I've seen. It's really hard to get there.
Okay, and maybe, you know, it's a lifestyle change. It's radical. I don't know. You know, it's
I would say that it's yes. I think if you could lose all the weight that's necessary, exercise 30 minutes a day vigorously every day of the week, eat everything that's appropriate, you will get better. But it's a very hard road, and HDL is just much harder to raise than LDL is to lower with a statin medication, for example.
Oh, I see. Yeah, and there isn't really a medicine you can take, is there, to raise HDL as there is with a statin to lower, or are they coming out with meds like that?
So we've actually tried a few kinds of meds, and they don't seem to work that well.
Oh, they don't? Okay.
No.
That's interesting. All right. Listen, we'll take a break on that note. Good questions, Joe. Brian and others, stay on hold if you're there. We have some lines open, some good questions already. 737-7587. For our cardiologist with us this morning, we'll take more of your calls and more of our discussion on heart health. Every month is Heart Health Awareness Month, but every day is. Come on, Doc. Every day.
Both morning and night.
Morning and night. We'll take a break and be back with more right after this. Sarah.